Good afternoon and welcome to today's webinar, COVID-19 Navigating Public Health Emergency Legal Responses Underlying Reopening State and Local Economies, brought to you by the Network for Public Health Law. I'm Charles Strong, the Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. A quick note that both the presentation slides and video playback for this webinar will be available on our website shortly after the conclusion of today's event. We strongly encourage attendee participation and would love to hear from you, so feel free to submit your questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your questions. We'll be addressing them during the Q&A session towards the end of today's event. Your moderator for today's webinar is Emily Carey. Emily currently works as a legal researcher at ASU's Center for Public Health Law and Policy and at the network's Western Region office. She is currently a senior articles editor on Jurymetrics, the Journal of Law, Science, and Technology, and served as president of the Health Law Society at ASU. Her areas of interest include reproductive rights, the opioid crisis, and vaccination policy. Emily will be leading us through the rest of today's webinar. So Emily, over to you.
Great. Thank you, Charles. It's great to be on board with everyone today. We have a fantastic webinar lined up on the legal issues that we see emerging as we reopen state and local economies. So from here, I will introduce our presenters for today, Professor James Hodge and Sarah Wetter. James Hodge is the Peter Kiewit Foundation Professor of Law and the Director of the Center for Public Health Law and Policy at ASU Law. He is also the Director of the Western Region Office of the Network for Public Health Law. Sarah Wetter is a law fellow at the O'Neill Institute for National and Global Health Law at Georgetown University. She also concurrently serves as a senior consultant for the Network for Public Health Law in the Western Region Office. Sarah holds a law degree from ASU and an MPH from the Johns Hopkins Bloomberg School of Public Health. So with that, I will turn it over to Professor Hodge to get started.
Well, Emily, thank you so much for that great and brief introduction, because what we've got ahead for us in regards to our program today is going to be fast, sensational, and we hope that we'll get across a lot of really valuable and important information. Now, here's a couple of things that may help along the way. I'll be taking you into some of the key fronts in regards to what we've got in emerging content here in just a second. But one of the things that we're really looking forward to, and Emily will walk us through several of the great questions and comments that we'll receive as part of this webinar, because we do know, Sarah and I both, and all of our team across the network, this stuff is happening in real time as we have regularly addressed in response to the COVID-19 epidemic through our various different webinars. So we're looking forward to your questions, and as Charles noted, be prepared to enter those at any point in time that you hear us talk on its subject matter in the Q&A portion. And the second thing is this. Listen, in conjunction with our great team, we've got a supporting memo that supports basically everything you're going to hear us talk about. That memo will be something that Charles, working through our national office, will be able to post in conjunction with the slides you will see as part of this webinar. So it may actually help to address and answer some of the questions too. Here's what we've got in the way of the contents for our session today. And just as a nice note, it's going to move fast, so we'll be prepared to actually cover what we've got ahead very soon. We're going to talk just real quick about the sort of pandemic itself. Those brief snapshots that we often start our webinars with are going to be even briefer today, because we all know where we stand in regards to COVID-19 in the United States. Let's just take stock of that and just how we got here in relation to social distancing efforts. We'll talk about the sort of emerging reopening strategies and efforts that are occurring as we speak among states, tribes, and localities in the United States, with significant urging from the federal government. We will talk about the legal and policy controversies, cases, and issues. We'll have a lot of examples of that. In fact, we'll take an approach where we actually introduce like 5 issues within each of the major domains of which these controversies have arisen, and give you like a focus slide. Here's what's really happening in this specific arena. Let's talk about potential actions and resolutions. Sarah will carry us into that portion of our discussion. Then we'll take great Q&A. Listen, nothing that we do in relation to this webinar is possible without the great contributions of our entire Western Region team. Special acknowledgments to our fantastic collaborator, Michelle Natrika, who's on board with us today, who's done some tremendous research with us on these fronts. Emily, you've heard from. She's not just our moderator. She's done some great research and guidance in relation to some of the topics you'll hear. And then 3 of our additional fantastic students, Elise Pendergrass, Hannah Rinke, Claudia Reeves, all contributing extensively to the types of material that we're about to discuss here as we go forward. So thanks to all of our Western Region team and so many others. Here's where we are. I don't think any of us could have possibly imagined how quickly and how rapidly we'd accelerate to this point in time where the nation's covered with cases in every single state, thousands and thousands of cases, in excess of 1.6 million known cases, obviously considerably more that are yet to be tested and or diagnosed. The stat at the top of the page is there for a single reason. When you look at the U.S. performance in relation to COVID-19 globally, even though the U.S. has 4% of the global population in the world, we do have 31% of all known global cases and 29% of all known global deaths. These numbers will change over the course of the summer, to be sure. But just how significant this impact has been in the United States couldn't have been punctuated any better than what you saw on the cover of the New York Times just earlier this week, I believe on Sunday, predicting we'd be at 100,000 soon. We're there. 100,000 plus deaths in the United States in about 3.5 months. These are unbelievable and profound consequences of the most significant pandemic to obviously sweep across the globe in the last literally 100 years. And we're not beyond what and how much this specific pandemic will impact the United States in the next few months to come. These specific outcomes have occurred despite unprecedented responses that we have consistently pointed out in our webinars in the past and what we do with our COVID legal primer and all of the work that's being done at the federal, state, tribal, local levels to proceed in regards to emergency responses through every level of emergency possible in the United States. This map that you've seen me present before just presents something you've never seen and may never see again in the United States, particularly every single state and literally hundreds of localities all in declared states of emergencies of different types. The next slide, I think, is particularly telling because while you may have seen this before if you've been on board with us with various webinars with the network, here's the one you haven't seen, and it's blank. These are all the states so far that have rescinded or allowed to lapse their emergency declarations. What's relevant about this, and we're going to keep track of this, of course, over the summer ahead, it's the lapsing or the rescissions of those emergency declarations that are going to lead to some really profound legal observations that we'll be tracking and working through in real time. We almost saw the state of Iowa, Governor Kim Reynolds there, suggested she might consider allowing her emergency declaration to lapse, but did renew it for another month just, I believe, yesterday. So to that end, we're going to watch for this very carefully. The moment that we see these types of lapses or rescissions is the moment things change. What we've been engaged in pursuant to these emergency declarations is systematic efforts to literally build a sustainable, potential legal environment that can actually work hard to address all of the different issues that you see within the pandemic itself. The response efforts pursuant to these emergency declarations cannot be discounted or de-emphasized. Honestly, we've never seen response levels at this purpose for this extensive a period in the United States, literally ever. So to that end, this is truly unprecedented material. But I think we all know that what and how much this has impacted the United States has been cataloged largely with what we see in social distancing measures. Truly exceptional, extensive, long-standing utilization of these types of measures across the populations in the United States at literally every level of government for various different purposes. And so how these have played out has been really quite interesting and phenomenal to see. We've seen social distancing measures taken along the same lines of what you're seeing on screen here, the quarantine efforts, the isolation efforts at all levels of government, from federal down to local. We've seen curfews implemented in specific locales. Here's one from Navajo Nation, which implemented a curfew, many others along the way as well. Just significant continued travel restrictions, various limitations on assemblies, particularly impacting churches and other religious enterprises, evacuations even of ships and boats and planes. And these are just really truly sensational efforts to engage in social distancing on a wide scale. And then we have, with apologies, then we have all of the various different ways in which we might justify these types of social distancing efforts. So if I may, let me go back real quick because I missed one slide. The closures and cancellations we cannot discount either. We've closed everything across these specific arenas, and to be sure, that has had profound repercussions. Just to be sure, what you're seeing in relation to the systematic implementation of shelter-in-place or stay-home orders across the United States at the state level, local levels, also really profound consequences for just how much and how significant social distancing has become. We've seen states try to actually classify systematically what's closed and what's not closed based on what's an essential versus non-essential business. States and localities have differed on this extensively. This has led to its own series of controversies, including the sort of exceptions that you've seen allowed for these specific instances. Now, with all of these types of social distancing measures in place, do you remember how we justified all of these measures just a few months ago? Do you remember all of the different public health bases for which we suggested these types of social distance measures would be essential? We needed time, and we still do, to fully assess the epidemiology underlying what you're seeing in real time. We are learning more about COVID-19 as a spreadable condition consistently. New guidance from CDC, from state health departments, and others continue to provide us information. We needed time to assure mobilization. Field hospitals set up in Central Park and other places. We needed time for that. Social distancing created at least a window for accomplishing that. PPE, personal protective equipment, was in grand short supply, leading to crisis standard of care implementation in so many places. We needed time to acquire that. We saw federal, state, local governments vie over and literally compete over who was going to get PPE. Those battles in March were significant. Time to find treatments, time to at least explore what the options might be, give FDA time to issue emergency authorizations for some treatments that might prove efficacious. We're still looking for those opportunities. Vaccines was the one I remember most specifically, and many of you all may as well, as the essential thing of which we needed time to actually generate. We are closer by the day to vaccines that may be available in the United States and globally, but to be sure, months away still. Most importantly, we needed time to save lives. And though we have lost extensive numbers of Americans, we have obviously saved hundreds of thousands of lives as well, thanks to social distancing, potentially even millions. There have been consequences, though, too. These consequences are the ones that I think are leading us into our reopening strategies, right? We have upwards of 40 million Americans unemployed. These are depression-level employment type of issues, obviously, and may only get worse over the course of the summer. Business failures, tens of thousands of businesses at risk due to these mass systematic closures. Government bailouts like you've never seen. And may never see in the United States again, but literally unilateral efforts across the Senate and the House to stimulate specific payments to businesses, to individuals for unemployment compensation. But we've also seen the consequences that relate to this type of social distancing in the form of active protests here in Lansing, Michigan, multiple other state capitals absorbing that and other places. We've yet to measure the mental health impacts of this type of extensive social distancing. They're there. We will be assessing that level of epidemic type of concerns over years to come. But the mental health impacts of social distancing at this scale, and with the lost lives that we have really had to experience in the United States, just profound consequences. So here's where we stand in many different ways. We're at the middle of this tug of war. On one side of it, we all recognize from a public health and safety perspective, we have not beaten COVID-19, and we're not about to anytime soon. This condition is serious, obviously spreads easily, and has no known effective treatments that are easy or simple, nor vaccines. On the flip side, we have economic interests that have obviously compelled us into reassessing exactly what and how we're going to reopen the country, which is precisely what you saw President Trump and others mandate, or at least suggest was essential on April 16th. This is when the White House released its guidance initially for state and local governments to consider. And it was based on regional gating criteria about what sorts of things we'd have to see within states to authorize and seek those sort of early efforts to open the door to new opening of businesses and other specific arenas. I think we all know once you open that door, it's going to be hard to close it again, to be sure. The phases of which we saw the White House in conjunction with CDC suggest for how we actually do this, Listen, these phases are being put into place in some states, but not all. Some have bypassed multiple of these specific suggestions, gone straight to reopening strategies, and worked to reopen things like essential businesses, manufacturing plants and other arenas, the light retail that you're now seeing opening within localities, salons, barbershops reopening, bars, gyms, restaurants, all of these subject to reopening in some states under various different norms or various different sort of social distancing initiatives. To be sure, this country is reopening against a considerable array of public health concerns. And then along the way, as part of this reopening, we've seen massive legal controversies. Now, we predicted this weeks and weeks ago. We said the moment we get to that juncture where the tug of war starts to shift in favor of reopening, the controversies were going to come out of the woodwork. They have. We're classifying them, at least on this webinar, for our ease of purpose in regards to 5 major areas. Federal versus state controversies. We'll hone in on that in just a second. State versus local, those sort of local, home rule type of initiatives, where and how local governments are actually working against what states are doing or how states are getting tough with their local governments. We're seeing state versus tribal. Sarah will move us into that specific arena. The public versus private sector initiatives, gosh, and the controversies there, so profound, especially over Memorial Day weekend. You saw so many battles in relation to public versus private sector initiatives to gather and to literally see mass crowds in places we all know from a social distancing perspective is problematic. And then Sarah will wrap up with us in regards to her great observations on the employee versus employer setting. So, as Dude noted, the types of issues we're going to explore now, I'm going to give you 5 or so good examples of each of these major 5 areas, focus on one particular one that gives us and hopefully highlights the types of legal controversies that we're experiencing and maybe just how to work around them in our Q&A as we go forward. We're going to implicate a lot of constitutional issues. You've heard me talk about, if you've been on prior webinars with us, these types of concerns. They're both structural concerns about separation of powers, federalism issues, and they're rights-based concerns like freedom of expression, of assembly, freedom of religion, due process. All of these icons on screen may reappear in some way, shape, or form in our slides, but to be sure, it's a constitutional battle extraordinaire that we're seeing nationally, particularly at the federal versus state level. I mean, these examples are exactly what we predicted might occur at the moment in time when the federal government decided it's time to get this economy on a national basis restarted, and states were reluctant or concerned, or local governments were reluctant or concerned. But you're seeing calls for President Trump, for example, challenging Pennsylvania Governor Tom Wolf to, hey, liberate PA, basically, he said. Reopen the economy in the Commonwealth of Pennsylvania. Make it happen and make it happen now. President Trump has all but tweeted to that effect, resulting in some concessions in relation to what Governor Wolf is so concerned about and has been throughout the course of his administration, the potential for widespread, extensive damage related to early opening. You saw Governor Cuomo in New York have to rebuke the president's claim way back in, earlier this month, where the president all but said, actually in April, all but said he's got the authority, total authority, to reopen the economy, and states will have to fall in line with that. Multiple states rebuked that for good reason. There are significant federalism-related concerns underlying the president's assertion. Governor Cuomo directly rebukes the president's claim of total authority, and you've seen President Trump back off of that quite extensively. Still, the battles at the federal-state level confound as we go forward in regards to reopening strategies. Did you see what happened in Michigan when the Attorney General had to issue a letter to President Trump basically pleading with the president, please wear a mask when you actually visit the Ford plant here this past couple weeks or so ago? It's state law, and it's Ford's policy. President still did not mask up in full view, obviously, in relation to his visit. The house of worship-related issues here have become among the most sensational and controversial issues that have arisen. You're going to see us highlight these in a couple different ways. President Trump has clarified just before Memorial Day he sees religious enterprises, religious entities as essential. He sees them as essential, which basically classifies and suggests they should be open now, fully, and fully able to re-engage in services with some social distancing measures that CDC has issued some recent efforts to that effect. but he literally wants to override governors that might resist this. You'll see that in just a moment. And then this neat case, Bailey versus Pritzker out of Illinois. This is a Representative Bailey who's actually challenged Governor Pritzker in relation to a stay-home order and gotten some extensive additional sort of litigation underway in states like Illinois and so many others across the U.S., where you're literally seeing these in-state battles of a particular jurisdiction fighting over just how much from a Republican/federal perspective on this reopening strategy may get played out at the state level against a Democratic governor in Governor Pritzker. Fascinating. But to be sure, our highlight here comes directly out of California, because what the Department of Justice sent in regards to a letter to California's Governor Newsom just recently on May 19th is something that we're starting to see DOJ take considerably more seriously. They flat out told Governor Newsom, you need to take a different approach in regards to reopening churches and other religious enterprises in your state. You're classifying them as if they're more risky or more dangerous to reopen than other businesses which are currently being opened across the state of California. DOJ characterizes this sort of deferential treatment as unconstitutional pursuant to one of the Supreme Court cases, Economies versus City of Hialeah. We can talk about that case a little further. It's a profound decision with a majority unanimous decision, but it doesn't exactly stand for what the Department of Justice has suggested. Houses of worship may now be open in California pursuant to some concessions here through Governor Newsom, but to be sure, it's going to be a profound debate over the course of the next several weeks ahead in a lot of jurisdictions. What about the state versus local issues, the financial feuds, the face mask related concerns, reopening entertainment and recreation concerns, the battle over what actually constitutes non-essential businesses, and the constituent health concerns? You're seeing these issues arise as noted in Pennsylvania, where Governor Wolf there again had to actually tell explicitly several counties that moved to reopen as the state was maintaining its social distancing measures, hey, don't do it. Governor Wolf making very clear in a very, very terse message, I will withhold funds and I will issue various sanctions against offending businesses, including pulling their liquor licenses, their licenses to engage in business itself. Fascinating and powerful. The face mask requirements. Texas Lieutenant Governor Dan Patrick pretty much denounced local officials' executive orders in Harris County, Houston area, basically suggesting to people to wear face masks. Said the Lieutenant Governor, it's the ultimate government overreach. These battles, state versus local, on something as simple as face masks, as CDC has recommended their use in public settings, extensive and problematic. You've seen the debate in Nevada. The governor there having to all but condemn Las Vegas Mayor Carolyn Goodman for her plans to actually reopen casinos in the city. Now, this is a debate happening at the tribal level, too, as you'll see in just a moment with Sarah. But to be sure, you're seeing casinos planned for reopening in Las Vegas despite very significant concerns at the state versus local level. The battle over non-essential businesses, gosh, in New Mexico, it's Supreme Court having to tell the local mayor of Grant, New Mexico, that its effort to reopen non-essential businesses is just not going to happen, that literally having to shut that initiative down as a mayor within the state of New Mexico sought to do something that just would not be consistent with the governor's indications there. And then finally, these constituent health concerns. Sometimes it's local versus state, obviously. And in Georgia, which through Governor Kemp sought to be among the first states to reopen quite extensively and did go forward, even despite President Trump's own concerns. Gosh, Atlanta's mayor and so many others having to actually literally fight back a little bit against that, seeking whether or not they had home rule sufficient to actually address and to put into place additional measures. That's our highlight slide here, too, to be sure. What happened in Wisconsin is almost unheard of and unprecedented. The Wisconsin legislature sues the governor and finds itself in Wisconsin Supreme Court, of which issues a decision basically saying that stay-home order you issued, Governor, through the Department of Health, unconstitutional. It wasn't done procedurally correct. They literally negate the stay-home order against Governor Evers' concerns. But the response locally was fascinating. Madison's mayor, Milwaukee's mayor, both indicating initially, we will not allow for businesses to reopen consistent with the negation of that particular order. We're going to use our own home rule powers and capacities to actually keep things as much within social distancing measures as possible. These debates at the state, local level happening across the country, it's fascinating. Now let me turn it over, if I may, to our great colleague, Sarah Wetter, who will take us into the state versus tribal initiatives. Sarah.
Thank you, James. Now we're going to turn to state versus tribal issues. And as tribes are sovereign entities with their own laws, conflicts are arising as tribal reopening plans may conflict with state plans for reopening in the surrounding areas. So we're going to look at three main areas where controversies are arising. The first, reopening communities. An example of that comes from New Mexico, where the governor used her emergency powers to lock down the city of Gallup, which is located just outside of Navajo Nation and is frequently visited by members of the tribal community in order to access essential supplies. So shutting down that city had huge implications on tribal members, even though it was done largely to stop the type of travel that could allow COVID-19 to spread. It has issues related to the right to travel and equal protection having a disproportionate impact on tribal members. That order, that lockdown of the city of Gallup was lifted on May 10th. However, the city remains quiet. Conversely, in New York, the St. Regis Mohawk tribe, it remains closed under a lockdown and a curfew even as the rest of the state reopens. So visitors are currently not allowed to go into that tribal area to visit. Next, restricting travel is another big area of arising controversies. In South Dakota, 2 different tribes have issued checkpoints going into and out of their lands in order to prevent the spread of COVID. These tribes really are not equipped to handle a pandemic. They might be several hours away from major health facilities for critical health care and only have a limited number of beds on their own tribal lands. So they instituted these checkpoints to stop the spread of COVID. However, South Dakota's governor ordered them to be removed. And her authority that she cited was that even though the checkpoints were going into and out of the tribal lands, they were still on state and federal highways. So in order to enforce her removal of those checkpoints, she has invoked assistance from President Trump and the Bureau of Indian Affairs in order to get their backing to remove those checkpoints. Casinos present a third huge area of arising conflicts. Tribal casinos that are on tribal land and owned and operated by the tribes are planning to reopen in some cases well ahead of the rest of the states where they're located. In Connecticut, the governor recognized that the Mashantucket, Pequot, and Mohegan tribes do have the authority to decide when to reopen their casinos, but warns that the impact extends far beyond the tribe and really the public health of all. So the governor noted that while they have that authority to decide when to reopen their casinos, that he could revoke the casino's state-issued liquor license. But so far, the casino has issued its phased reopening plans and is complying with social distancing orders issued by the state. But perhaps less friendly, what we're going to focus on now is a similar issue coming out of Michigan, where the Hannahville Indian community plans to reopen their casino on May 16th, which was weeks ahead of when the stay-at-home order would expire on May 28th. The state's attorney general then threatened civil and criminal penalties against casino employees and patrons of the casino that were not members of the tribe and still remain subject to state law. But the casino then did set a new tentative reopening date for June 1st. Next, we're going to turn our attention to public versus private sector concerns. This whole list of lawsuits that you see here are arising where businesses do not want to comply with state or local orders to remain closed. And they're bringing multiple different types of claims. That first one that you see, Friends of Danny DeVito v. Wolf, that was a bunch of businesses in Pennsylvania that brought a takings claim against the governor, stating that forcing them to remain closed constituted an unjustified takings of their business, of their property. The next one below, Poopy's Pub and Grub, that is a biker bar out in Illinois that over Memorial Day weekend had a party with hundreds of bikers in attendance. They were ordered a cease and desist order, and then they retaliated by bringing this lawsuit against the state's governor, bringing due process claims. Tesla, out in California, also brought both due process and equal protection claims against Alameda County. California's reopening plan allowed counties to issue stricter or extend the stay-at-home orders or business closures, which Alameda County did. So Tesla then argued that it was an infringement on their due process because it was an unreasonable order that they were to remain closed, and also equal protection, stating that it was unfair that they had to remain closed while manufacturing plants in other counties were allowed to open. So fortunately, Tesla did come to an agreement with Alameda County where they were able to start basic operations ahead of the rest of the lifting of the stay-at-home order. We saw similar claims coming from gyms out in Illinois, bringing due process and equal protection. We're going to look at gyms a little bit closer in just a second. And then also in Oregon, several businesses sued the state's governor, Kate Brown, under both takings and due process claims. However, the court dismissed their request for an injunction, finding that Kate Brown, the governor, does have the authority, the quarantine authority and the social distancing authority to require those businesses to remain closed. So now we're going to turn our attention to the gym out in Victorville, California, which reopened on May 1st ahead of California Governor Newsom's executive order and was then cited. But still, the owners had no plans of shutting down, asserting their constitutional rights, posting the Constitution right on their doors, and tweeting the governor in challenge. When then threats were issued by the city of San Bernardino against the county of San Bernardino, the gym then sued the county, alleging their rights to reopen. So we will see whether those claims hold any strength. But it's important to note that all those lawsuits that we just talked about were business owners suing the government. But what about the employees who then are required to return to work once their business opens and they can no longer collect unemployment and they have to go back to work? What legal protections might there be for employees who are then required to return to unhealthy or unsafe working conditions where they might themselves become sick and spread COVID to the rest of their families and friends? So here are some potential legal claims that might be available to employees. The first, workers' compensation, which is the typical and usually exclusive remedy for workplace injuries. However, some states are coming out and stating that their workers' compensation schemes might not apply to the unique hazards brought by COVID. So other types of claims might be available to employees. One area might be wrongful termination. If an employee faces adverse action for seeking COVID protections. For example, so there are some pending lawsuits where employees have asked their employer to provide masks or to allow them to telework when they were sick and were fired because of these actions in seeking protections. So in such cases, wrongful termination claims might be available. Discrimination cases might also be on the rise. If persons are fired or discriminated against on the basis of age, parenthood status, health status, or other characteristics that are protected by federal or state law, they might be able to seek relief under a discrimination claim. Also, the Federal Americans with Disabilities Act requires employers to provide reasonable accommodations to employees with a disability, and that might come into play during COVID-19 with cases with persons with asthma or other conditions that might make them more susceptible or more at risk of COVID. Public nuisance claims. We're already seeing some of these cases come out. For example, in Missouri, the Rural Community Workers Alliance sued Smithfield Foods, a meatpacking plant, alleging that those meatpacking plants were basically COVID hotspots, such that they constituted a public nuisance. However, the court did dismiss that claim, finding that OSHA had primary jurisdiction over the workers' concerns. And finally, negligence and intentional torts. Several states and also the federal government through the CDC and OSHA are issuing safety measures that employers are to comply with as they reopen. But if they fail to provide proper safety measures, negligence and intentional tort claims might be available. So now we're going to focus in on a recent case coming out of Illinois. McDonald's employees filed a class action against the fast food chain just as they're starting to reopen certain dining rooms. The plaintiffs are alleging that McDonald's breached its duties to provide its employees with masks, hand sanitizer, and gloves, and also to inform employees when staff and coworkers tested positive for COVID-19. So we'll wait and see where that lawsuit goes. But what kind of actions and resolutions, what might we see in the forthcoming weeks and months ahead? We might see litigation that could redefine civil liberties during emergencies and just how far states can go to protect the public health, especially related to some of the freedom of religion claims that James talked about. We might also see how preemption issues are shaping governmental emergency roles. We're seeing a lot of conflicts both between the federal and state governments and state and local governments. And what happens when a local government is seeking to use their home rule authority to act in the best interest of public health, but are getting shut down by the state level. We also might see officials seeking to address certain inequities tied to reopening. As schools are reopening and businesses are reopening, and some are still staying home while others are going to work, inequities are sure to arise that officials may hopefully seek to address. But on the other hand, we're also seeing legislation coming out of states like Utah and even discussions at the federal level that would immunize businesses from COVID-related claims. The interest here, of course, is economic. It's allowing businesses to reopen, to restart economies without the fear of a slew of lawsuits. But at the same time, this type of legislation could disincentivize employers from taking all possible steps to mitigate the risk of COVID. So that brings us to the end. As you see here, James and I both have our contact information, but we're also happy to take your questions now. So I will turn it over back to Emily to lead us through the Q&A.
Thank you, Sarah, and thank you, Professor Hodge. We have some great questions coming through, so I will start with the first one, which is relating to some of those state v. local issues that you were talking about, Professor Hodge. So why can some governors state that their local authorities cannot be more restrictive than the state-level proclamations, for example, like we're seeing in Georgia?
Yeah, it's a great issue and a really practical one that's showing up all across the country, Emily. And to be sure, this is why and how the issues in relation to preemption are coming up, as Sarah was noting, and why and how we have such battles at the state versus local level. Look, locals are on the front lines. They're seeing exactly what COVID-19 is doing to their populations, and it's not that states are removed from that. State governors are particularly concerned as well. Those disagreements, however, do land in regards to how we think these things through from a preemption or other particular perspective. And just to answer them as quickly as we can, noting we've got a lot of great questions and comments, it really works along those same lines as what and how far a governor wants to go to preempt localities from doing anything inconsistent with what states are ordering in these extended emergency declarations. Remember that slide. No state is rescinded its emergency declaration. Every governor, consequently, has the capacity to continue to issue emergency orders, of which take precedence often over home rule-related concerns. Boy, you're going to see that play out over the next several months ahead as we see localities and states continue to battle for dominance and issues in regards to who's got the legal authority to act. Generally, those states are going to win those battles too often because of those state emergency declarations. Emily, great question. What else you got for us?
Great. Okay, so the next one is relating to some of those questions surrounding places of worship. So some church leaders have begun to openly defy stay-at-home orders by holding church services, arguing the right to practice their religion is infringed. What does the case law say on this, and can public health win this fight?
Okay, that's a great one. And Sarah, you may have some comments to this effect as well, because these battles are happening, I literally think, in every state. Now, some of the more dominant ones you're seeing are starting to come out of places like Texas and California and other issues, but literally every state at some point or another has gotten involved in relation to these specific issues. These are easily resolved, I truly think, but yet they're so controversial. You want a negotiated deal that actually works well for all of the religious communities across a specific jurisdiction. But the moment that a particular religious enterprise walks into court and suggests they have a free exercise right to reassemble against even what's known to be effective, efficacious social distancing measures, that's a losing argument. And the reason for it is the Supreme Court has made perfectly clear that generally applied social distancing or other types of measures that might apply to religious enterprises just the same as other types of enterprises of a business or nonprofit sector, those are constitutional. And when government has compelling interest like it does in preventing COVID-19 spread, it's particularly confounding in relation to how much we can limit specific free exercise interests for a duration necessary to tamp down COVID in regards to its implications nationally or at a local level. So the Supreme Court's been quite clear on that, even though you see the Department of Justice arguing in a single case line that a particular jurisdiction case actually out of Hialeah, Florida, that resulted in a sort of rescission of a particular ordinance there to stop a particular religious practice. Well, I mean, Department of Justice has pushed that case as if it's dispositive. The reality is it's not. Free exercise interests that religious enterprises may have do at times have to succumb to the particular public health and safety measures. Is there anything to add on that front?
James, I thought that was a great response. And like you said, generally applied social distancing measures are constitutional. And like you said, also the DOJ is trying to work that angle where states have treated religious organizations different than secular organizations like malls. So they're definitely trying to work those angles that could be available to them. But like you said, it's a narrow possibility.
Good point, Sarah. And actually, in relation to religious enterprises as employers, too, there are going to be some interesting arguments on that front, too. But Emily, you've got more for us. Keep going.
Yes. Okay. So related to that, Sarah, and a bit what you were talking about before with the employee versus employer issues, we have a question that came through. Could a governor or public health authority require employers to report employees who are determined to be infected or exposed?
Well, yes, there are reporting requirements issued through health departments where they could be required to report certain cases of COVID. And that is really what is going to be essential as we move forward, is identifying those cases, doing the contact tracing and the testing to figure out how far it has spread, and then once those persons are identified, then isolating them. So that will really be critical as we reopen both employment settings and schools, that we are able to identify persons that are infected or exposed, contact tracings, and then isolate persons who are known to be exposed or infected. So that will be an absolutely critical part of reopening for the public's health.
Great. Okay, so our next one is related to the Wisconsin Supreme Court decision. So can you comment on the fact that Wisconsin, while still under an emergency order, has effectively reopened due to the Supreme Court's decision?
Yeah, I think this has just been a fascinating development. We somewhat predicted, Emily, all along in relation to tracking just how extensive these social distancing measures were going to impact populations, that you would see some of these battles occur, but honestly, to see a Supreme Court of a state actually issue a decision that goes up against state health authority and the discretion to issue these orders and literally negates them on procedural grounds has been quite profound. But it's also illustrated something that's neat, and it's playing out across multiple different states, and that is what and how citizens and residents, that is, of Wisconsin have responded, as well as how localities have responded. And so the slide that we introduced earlier, where we literally showed how Madison and Milwaukee mayors have literally basically said, we're going to continue to enforce to the full degree of our home rule any local orders that will still require or mandate social distancing. Governor Evers, I think, largely in support of that, even though his own order at the state level through his Department of Health was negated. These types of initiatives are playing out systematically. There may be additional litigation to go this summer because I think you're seeing increasingly Americans' patience with social distancing obviously coming to a thin line. As we see that go forward, continued litigation on these specific fronts. It does not mean that a state must reopen immediately, but it does potentially put local governments more in charge of what these decisions would allow to the degree they're given discretion via governor's emergency orders or otherwise. It's going to be a profound summer of seeing just how this plays out in so many localities, especially as COVID rears its ugly head again in regards to additional cases that started to show up early in some of the states that reopened initially. It will be fascinating to watch. Emily, go ahead.
Okay, next one. Can you speak a bit about legal issues related to schools reopening overall and with regard to students and teachers at high risk?
Great. I'll be happy to address that, Sarah, but let's also hear from you in relation to that because schools in the employment setting have a lot at stake as well. Obviously, what you're seeing nationally in regards to school reopening is calls for that to occur even during the course of this spring term, although largely over now. But you did see states like Montana toy with the idea that local school districts were going to reopen. Perhaps even some did under Governor Bullock's suggestions there earlier this month of May. But the reality is almost every school made critical choices to remain closed and stay that way as they foresee what their future looks like, especially at the university level where business models are being severely challenged in relation to when and how quickly they can reopen to actual physical classes being conducted in real time within specific university settings. The guidance here is basically, I think, one to anticipate and to continue to watch over the course of the summer. The good news is, except for, of course, summer school classes, which are being done virtually across almost every level of school, the good news is now we do have 2 to 3 months to actually assess fully what the opportunities are. California state systems made it very clear. We will be in a virtual setting for the remainder of the year going into the fall term. But so many other university school systems at every level are actually trying to plot the ways in which they can safely reopen. The strategic elements of that, I think, can be put into place. But the legal ramifications of it, when you start to see student populations with increased COVID cases, faculty and others with increased numbers of COVID cases, it could get very profound quickly. I think almost every sophisticated school system is backing up their plans with how to go virtual again as need be. Sarah, anything to add on the employer side of that as far as schools that are considering all the extensive issues that relate to employers of teachers and administrators?
Yes, and another issue that's already starting to arise as we think about schools reopening in the fall is the confluence of COVID and influenza once influenza season hits its peak. How can we protect the employees of schools and universities as well as the students? And schools, universities are already starting to think about that as we've seen some schools announce that they're actually going to be starting early in order to end their classes before the peak of the flu season. And we've also seen some universities issuing plans about requirements for masks, temperature checks, and even some requirements for flu shots come flu season. So that's sure to raise a lot of legal challenges that we will see as we get into the fall.
Great point, Sarah. Emily, what else you got for us?
Okay, the next one. In some of our jurisdictions, we are seeing elected officials rescind public health officer orders. What can be done to uphold these public health order protections?
Oh, that is such an interesting point. I concur with you completely, Emily. This has been very interesting to watch and see. Literally elected officials overriding what were, sort of discretionary and or highly relied upon public health orders just 3 months ago, now being overridden by elected officials that, again, as I was noting earlier, America's patience with some of the social distancing measures is wearing thin. It's being particularly seen among some elected officials, I dare say, too. Perhaps back to that tug of war analogy that we actually suggested earlier about where we stand. The tug of war, if it leans in favor of precisely how we're thinking through this as a war between public health and safety versus economic interests, these concerns will arise. So listen, here is what I think the summer of 2020 has in head for public health officials. It's time to stand ground in relation to what we know will work in response to COVID-19. This was something that our great colleagues in our Mid-States region, Denise Chrysler, Peter Jacobson, talked about in a prior webinar, and it's actually available on our webinar or on the network website. I highly recommend seeing it again. They talked about strategy. How do you actually hold ground against some of what will be politically dynamic and problematic in respect to COVID-19? Their strategic initiatives there and what they were raising are precisely what you're seeing happen across the country as we speak. But as a contrast in how to best address those specific issues, we've got to remember what the full extent and statutory and regulatory authority of public health authorities at the state and local levels and tribal levels include, how to exercise those specific initiatives, even against the backdrop of politically unpopular concerns about how significant we need to reopen the economy, and how to actually work towards at least addressing the efficacy of those specific provisions. So when we talked about the issues that relate to, why we engaged in so much in relation to social distancing, reminding people this is what we're after, about saving lives in real time. The only way to do it with COVID-19 is to rely on some of these specific initiatives from a social distance perspective. Notwithstanding the consequences, remembering the lives saved in excess of millions, hopefully in the United States, despite 100,000 lost now. I think we will have those challenges ahead. We'll have to revisit and remind Americans that these challenges are surmountable. We can prevent COVID-related morbidity and mortality, but we still have to rely on some of these really proven techniques. It's going to be a very tough and interesting summer to see how that plays out.
Okay, great. Thank you, Professor Hodge. The next one. People refer to their constitutional right to open their businesses, to attend public events such as car racing, to go to the beaches, and not to wear a mask. Could you please articulate the legal grounds for some of those statements?
Okay, so Sarah, I will articulate a couple of legal grounds, and then I'll turn it over to you on the employment side of it, just because I think this will be a fascinating opportunity to hear your side of that too. We have heard these arguments now. They are really showing up in all of the different cases. Sarah talked about multiple of the cases. We've seen these consistently arise, and they're along the lines of that government or that individuals have some right to work, they have some right to reassemble, they have rights to engage in their specific, social activities and such. And actually, to be perfectly frank, the best way to articulate these rights is to acknowledge that they don't exist, not against the backdrop of COVID-19. So let me really try to be clear on that. I like particularly some comments that I've received from some media members about, 2 weeks or so ago. There were right-to-work related arguments that were arising in a particular state. People literally saying, you have to reopen the economy. I've got a right to work. I've got a right to run this business. As you're seeing in Pennsylvania, businesses are actually challenging Governor Wolf on the fact that they were almost taken away in regards to their business interests in a regulatory taking environment. I don't see that as a winning argument, but this notion of a right to work is unfounded. It doesn't exist. You might characterize it as a liberty interest that's significant, to be sure, but it would always succumb to the public health and safety related concerns that arise in running a business that might pose risks to the community. It's a fascinating argument, but really groundless in relation to it as a freestanding, existing sort of claim that you might see start to rise in your own jurisdiction. Sarah, anything to add on that you've seen under these litigation patterns?
Yes. Well, it's important to note, following off of what you said, that in that whole list of lawsuits that we pulled up where businesses and business associations were suing state and local jurisdictions, none of those claims have yet shown any merit. In fact, quite the opposite, like what we've seen out of Oregon, where the court directly recognized that the governor does have the authority to implement social distancing measures in times of an emergency and to order business closures. So it's been quite the opposite than, like James said, a recognition of these right to work. And even if there was a liberty interest found in the right to work or the right to run a business, it is certainly not an absolute right, but rather only limited to the extent that your exercise of that right could pose a risk to the public health of others. So
yeah,
I don't think
point,
we are
Sarah.
likely to see, I don't think we're likely to see any of those types of claims find merit.
Yeah, I think that's true too, at least among judicial courts that are grounded in what and how to assess the Constitution. Everybody acknowledges we've had to recalibrate specific constitutional concerns and interests. We've had to reassess them. I mean, your liberty interests, your First Amendment interests, your religious freedoms, they've all been recalibrated, but not unconstitutionally recalibrated. They always were subject to public health and safety concerns. We've never allowed constitutional rights to run ramshot over the health of the community completely. But yet, as you see these arguments play out, they have gotten interesting and profound, and some courts may start to see about how these economic interests become even more pervasive. We shall see. Emily, we've got just a little bit more time. What else do you have for us?
Great. Okay, so the next one. So far, we've seen the DOJ acting on its promise to step in when it sees problematic state reopening plans. At this point, the DOJ has submitted statements of interest for various cases. Moving forward, do you see the DOJ taking more aggressive legal action against states if these preliminary cases do not produce favorable outcomes?
Oh, Emily, yeah, let me tell you one thing that you saw with Attorney General William Barr just about 2 or 3 weeks ago, when he made a very clear statement in a memo that was probably all but endorsed and at least approved by President Trump, basically saying to states, get in line and follow our strategic initiatives for reopening, or be prepared for federal intervention that is going to challenge you on that front. It was a letter. It was issued in regards to assessing U.S. attorney intervention for specific cases. It didn't carry a lot of weight at the time, but since the Department of Justice, as it has done in California, as you're seeing on this slide, has issued more pointed, more direct letters with more threatening guidance in relation to what it expects states to fall in line with in regards to reopening strategies. So yeah, do I suggest that DOJ may actually be putting some teeth behind this letter? I do, and I think you might see it happen in the near future. President Trump has all but somewhat threatened states directly with withholding funds from those states that don't get in line. You saw that in Michigan and other jurisdictions. The Department of Justice is raising issues under First Amendment parlance. They're raising interstate commerce-related concerns. They have the capacity to raise these issues. Do they have the ability to win? That's going to be an interesting issue playing out in federal district courts or higher courts in the very near future. But yes, are they putting teeth behind this? We're starting to see that. Even Governor Newsom has had to make, or at least considered making some changes to its California state approach to allowing for religious entities to reopen as well. It's a fascinating observation. And yes, I do think we'll see some active efforts on the Department of Justice side through U.S. attorneys in the near future.
Great. Okay, so I think we have time for one last question. Sarah, I will direct this one to you on some of those state v. tribal issues that we saw. What are the key legal issues of federally recognized tribes issuing public health emergencies to subsequently close tribal borders?
Right. Thank you, Emily. So that question specifically relates to the checkpoints that we've seen issued by tribes in South Dakota. And normally, tribes do have the authority and create their own laws on tribal lands. However, the main issue there is that the checkpoints are on state and federal highways. So this is raising a question where it doesn't seem that there's a clear answer. Even legislators from South Dakota, whose districts include some of that tribal land, have asked the governor not to remove these checkpoints and cited certain treaties that they strongly believed gave the tribes the authority to implement those checkpoints. However, the Bureau of Indian Affairs then wrote a letter stating that as long as the checkpoints were not on tribal lands, the tribes had to consult with the parties who did own the land in order to initiate them on that land. So at this point, it is definitely an unanswered question, but it does raise constitutional issues related to the rights to travel and equal protection, like we even saw with the St. Regis Mohawk tribe in New York. So these legal issues are still playing out, and we're seeing different constitutional issues arise.
Great. Well, thank you everyone for your participation in today's webinar, and thank you to our panelists, James and Sarah, for presenting today. Just a few final notes to all of our attendees. If you did submit a question that did not get addressed during the Q&A, don't worry. We'll be following up with you via email to ensure your question gets answered. Also, all attendees will be receiving an email from the network with the video playback of this webinar, as well as a link to our brief webinar survey. The survey takes just 1 minute to fill out and provides us with some really great insights, especially in regards to what topics you might be interested in for future webinars. Join us next Thursday for a webinar on COVID-19 and food insecurity, where we will focus on how federal nutrition programs can and have been utilized to address food insecurity during the pandemic, as well as examples of innovative policies implemented by states to address the food security of their vulnerable citizens. Learn more about that webinar and view the network's collection of resources on the pandemic at networkforphl.org COVID-19. That concludes today's webinar. Thank you all for attending and have a great rest of your day.